Welcome to this month's edition of Manatee Glens Report. I'm Mary Ruiz, your host today, and President CEO of Manatee Glens, the leading private hospital and outpatient practice specializing in mental health and addictions in the Tampa Bay area. Today's show is entitled Trauma, the Mind-Body Connection. Trauma is a serious injury or shock to the body. It's caused by a physical force such as an accident or an act of violence. A quick response saves lives. But trauma can also involve no physical signs of injury. Any event that is deeply distressing, painful, or terrifying can cause disability equal to or even greater than physical injuries. Today we'll meet with leaders from two local healthcare organizations who specialize in the treatment of trauma and who will help us explore the mind-body connection of trauma. Let's meet our guests now. Dr. Kimbrell, welcome.
Thank you.
Dr. Brian Kimball is the Trauma Medical Director at Blake Medical Center, and he specializes in trauma and surgical critical care. He completed his fellowship at the University of Southern California, so we know you like sunny climes. Dr. Kimball is spearheading preparations to bring a regional trauma center to Blake Medical Center, serving the Manatee, Sarasota, and DeSoto area. And greetings to you, sir.
Thank you for having me.
And I'd also like to welcome Melissa Larkin-Skinner, licensed mental health counselor. Ms. Larkin-Skinner is Vice President of Residential Services at Manatee Glens. Melissa administers a 24-hour behavioral health emergency access center, a licensed specialty hospital, crisis center, and addiction center. That sounds very busy.
It is.
She's a recognized expert in trauma care and has been training behavioral health professionals in the region to respond to trauma. So good day to you, Melissa and Brian. And thank you both for appearing on the Manatee Glens Report.
Thank you.
Dr. Kimball, we understand that the Regional Trauma Center will be opening soon at Blake in West Bradenton. Tell us what it will mean for residents in the community to have a trauma center here.
Well, you know, currently in our trauma service area, as you mentioned, being DeSoto, Manatee, and Sarasota counties, there are no trauma centers. So currently patients are flown outside of our local area. This takes time, and in trauma, you know, the name of the game is time. So getting efficient, fast treatment as soon as possible can save lives, but it also can save or have better outcomes overall as far as recovery. So this will give our local community faster access to quick, efficient, great care for trauma. And it's also important for the families because, you know, one of the major problems is currently when patients are being sent further away, it's difficult for the families to go visit their loved ones who are injured. And I really feel that's a very important part of the recovery phase for both the family and the patient themselves. So now they'll have closer access and be able to visit them.
Well, and the follow-up care usually stays with the trauma doctor, right?
Correct.
So they're having to commute for their follow-up care as well.
Exactly. So now it'll be local, so there won't be as much having to be as much trouble.
And how is it going to change medical practice at Blake? Now we have trauma doctors, trauma surgeons.
Correct. So we're going to have trauma surgeons that are in-house 24 hours a day, as well as now with this we'll have anesthesiologist in-house, OR team in-house. So rapid care for not only the trauma patient, but any patient that really needs that care. We call that in trauma the halo effect. So not only trauma patients are getting this higher level of care, but it expands to all patients that come in.
So this is a really big deal.
Yeah.
That's wonderful. Great. Well, if we were to take the METV cameras behind the scenes and take it to the trauma center at Blake once it's opened, what would it be like, a day in the life? I know there's helicopters and helipads and all kinds of excitement.
Right. Well, you know, sometimes you're just waiting around for something to come, of course. But yes, we're actually working on our current helipad and adding a second helipad for helicopters to come. So we'll be having helicopters come in, bringing patients as well as ambulances. And you know, basically what you would see is whenever a trauma alert is activated, and that's out in the field by the EMS, first responders, all the team will come and respond to the trauma bay, which is in the emergency room area.
I imagine that's involving some renovations.
Yes, we're working on that actually currently and hope to have that finished in the next 2 months. 2 large trauma bays which can hold 2 patients each, trauma patients, so we could do 4 simultaneous resuscitations. But when that trauma alert occurs, the trauma surgeon arrives immediately there to the bedside, emergency room physician, respiratory therapist, radiology techs, 2 nurses who are dedicated just for trauma. The CT automatically gets open so that we can go straight to the CT as soon as we assess them in the trauma bay.
The CAT scan?
A CAT scan.
Yeah.
I'm sorry, yes, the CAT scan. And the team from the OR comes down. So it's a group of people who come down and are there awaiting the patient's arrival. So when the patient comes in, we're there waiting for them.
That's pretty dramatic. Maybe we can arrange a reality show. You're spearheading the residents for the trauma center at Blake. So what does it take for the hospital to get ready?
Well, you know, it's always a change for a community non-trauma center to become a trauma center. Some of the things is the renovations, as you alluded to earlier. We're working on building these new trauma bays. We're working on the new helipad. In addition to that, many policies, procedures, guidelines that are trauma specific, how to manage these patients, who all is on call 24/7, things like that.
Lots of details to arrange
Lots
that
of
kind
details.
of choreographing.
Right, and we're in the process also of getting all the subspecialty call coverage that we didn't used to even have, that most community hospitals don't have for these type of patients. Well, some examples would be making sure that we have hand surgeons on call 24/7, plastic surgeons 24/7. The trauma surgeons, again, the anesthesiologist, what other specialists, neurosurgeons that are not only on call but available within 30 minutes, which is the rule, so that they can't be tied up with anything else. With the trauma surgeon that's on call, we also have a backup trauma surgeon. So if that surgeon, the trauma surgeon's in the operating room, we have a second one that's on call at home that can come in. So multiple call panels that are being developed. And
sounds very exciting. I think, I wonder as a physician, the team is assembled together, they've gotten the trauma alert, they're waiting for the patient to show up. So what goes through your mind as you're waiting for that stretcher to come in through the front door, and then how do you proceed?
Right. Well, the good part is that they often will tell us some information at least, the mechanism or what had happened, and maybe a few of the symptoms or issues that the patient's having. So I start thinking through my head right away, what is it I might need to do immediately? Am I going to need to maybe have them intubated or the breathing tube placed for them? So if so, we'll start getting that ready and prepared so it's right there. It's always in the room, but just have it right there ready. If I'm going to have to do a quick procedure maybe when they first come in, I have all that prepared. So I like to think about that. But the reality about trauma, and maybe one of the things that trauma surgeons maybe like about it is it's every case is a little different, and it's a little bit of having to think on your feet and always something a little bit different, so you have to be able to do that as well. Right,
so you're in a very focused state of mind, just almost like an athlete, ready to make that play.
Yeah.
You have the playbook, but you don't know what's going to happen on the field.
Right, and the other part is making sure that everybody else knows what their role is also when they come in, and we do mock traumas in addition to practice that with everyone, but just make sure everybody knows what their role is and what they're going to be doing when this patient's coming in, and a little bit of what the story is, so they can kind of expect what it is.
So once the medical aspects are stabilized and under control, what psychological aspects of trauma do you become concerned about for your patients?
Well, there's definitely psychological aspects as far as people dealing with the injuries that they've had themselves. I mean, these are often people who are not expecting any type of illness. They're not coming in for an elective procedure. They're just going about their normal day when this happened. So there's a definite psychological component to that, and any injuries that may be permanent for them and dealing with that, as well as maybe others who were injured in that accident or incident, or maybe did not survive that and having to deal with that.
So maybe a sense of guilt of being the survivor.
Guilt of being a survivor, or maybe being the driver of a vehicle when there was a death in that accident. So there are many aspects of psychological trauma.
Imagine the families are pretty
The families also are very stressed, and it's at the beginning phase. If the patient is severely injured, that's the ones who you're really dealing with the most. And that actually also can be ongoing, especially if there's permanent disability or injury that has to be dealt with long term.
So Melissa, what would a behavioral health professional do to respond to some of these concerns?
Initially, they would provide supportive counseling. They'd provide information to the patient and the families, especially because, like Dr. Kimbrell said, the families, it causes a lot of stress for them as well. They can provide information regarding trauma and the effects that it has on a survivor and the survivor's loved ones, anyone else that might be involved in an
So they're more
incident.
prepared to look for what's coming up next.
Yes.
And when a person doesn't receive that kind of psychological support, how do the psychological effects affect the physical? And this is really a question for both of you. The physical effects of the psychological trauma.
Unfortunately, they go hand in hand. Not only is the physical trauma itself very traumatic and distressing for people, the event that caused the injury is as well. And so it's sort of a double whammy that people are hit with. For instance, a person could develop a phobia around the event that occurred. If
Afraid to drive.
Afraid to drive or ride in a car or ride in a certain position in a car. As well as the ongoing. Unfortunately, one of the things that has been proven over time is that chronic stress causes other physical problems. Ulcers, heart disease, all kinds of things.
Yeah, so, and I would also add that I think that the one's psychological health after this and how they deal with the injuries can affect how well they recover also as well, and how soon they can get back to a normal lifestyle and get through physical therapy. If sometimes they may have a depression or something afterward that really needs to be dealt with in order to help them recover from the physical injuries.
Probably the most familiar that people are with trauma is post-traumatic stress, and we have images of flashbacks and difficulty sleeping. And can you talk about some of those symptoms that a family member might recognize that a loved one really hasn't recovered?
Nightmares, definitely. Sleeping problems, irritability.
Now that wouldn't be one that you could recognize,
Irritability on things that normally the person wouldn't be irritated with, problems with relationships, problems connecting to other people, problems staying connected to what's going on around them, constantly kind of dwelling on the event or on the injury, whatever the case may be.
Kind of an obsessiveness about it.
Depression and anxiety are definitely major issues that go along with post-traumatic stress.
Well, we've mentioned post-traumatic stress, and we think of that most often with our soldiers and perhaps victims of tornadoes and flooding. Are those the most common forms of post-traumatic stress that you see in your practice?
They are not the most common events
now,
that we see.
Now that's a surprise. So what are the most common forms?
Any form of violence, domestic violence, muggings, burglaries. Even if people are not there when a house has been burglarized, people can experience post-traumatic stress from that kind of event because they don't feel safe in their own house. Sexual abuse, unfortunately, we see a lot of.
And maybe grief and loss, would that perhaps be interpreted as a trauma for somebody?
Definitely. Everybody handles things differently. Everybody's equipped to handle things a little bit differently. We all have different experiences in life. We all have different supports around us, different services available to us. Any event that is terrifying or disturbing or distressing to an individual, it can cause post-traumatic stress. There
was an interesting study released about trauma, psychological trauma, and if we have events that we respond to well and don't have too many in our lives, it actually makes us more resilient and stronger. But what can go wrong with a trauma event that doesn't make us stronger, but in fact disables us? What happens in the psychological dynamic to make that happen?
I think part of it is isolation, being isolated from anyone that can express some understanding of what the person's going through. People, when they start to feel depressed or anxious or any of these other things that go along with post-traumatic stress and a traumatic event or injury, they start to isolate because they start to feel like they don't fit in. And the more a person does that, the worse it will be.
And I imagine well-meaning friends and family will say, it'll be okay.
Yes.
Don't worry, don't think about it. And is that a good thing to do?
I don't think so, because it's impossible not to think about it. It's something that was very dramatic and traumatic, and it doesn't go away. It happened. And so I think a better approach is to just listen. When the person, the survivor, wants to talk about it, let them talk about it. But I also
And that's not harmful, that's actually helpful.
That's actually helpful. But I also don't believe in pushing people to talk about it when they're not ready. That makes them angry, typically. I think the best option is to do some research, with the internet and Wikipedia and everything that's out there now and available to everyone, even on their phones. There's lots of information.
To learn about the effects of trauma and understand what's going on.
And then to seek professional help. Maybe.
Well, since you've mentioned that, you administer a 24-hour psychiatric emergency room, Manatee Glens Access Center at Manatee Glens Hospital. What would a patient experience if they walk through those doors to attend to a psychological emergency?
What would they be experiencing if they're coming in, or what would they experience from our end?
You can handle it. You're the guest, so you get to decide how you want to answer the question.
Most people, by the time they come to us, are really, really in distress, kind of at their wits' end. And we're the last place they're looking, unfortunately. I'd like to be the first place they look, but that's not realistic. So a lot of times they're very depressed. Maybe they've been in bed for days. They just don't get up, crying constantly or crying intermittently throughout a day about what they and their friends and family probably think is really nothing because of what's going on inside. So when they come in, we try to give them a warm, welcoming atmosphere, try to make things as calm as possible. We have lighting and coloring in our access center to try to calm things down and make people feel welcome and warm and comfortable. And then they would speak to a counselor who would listen to whatever they had to say. Of course, they'd ask questions as well to try to understand what's going on. And then, we would do an assessment and then try to refer the folks to whatever service we think might be most helpful to them.
Right. And I think that your facility, just like Dr. Kimball's emergency room, is going to be open 24 hours, 7 days a week. So as I mentioned in the introduction, you're conducting regional trainings with counselors on trauma-informed care. And I wonder why these trainings are necessary. Are we seeing more trauma?
I don't know that we're seeing more. I think we're becoming more aware. And so we're conducting the trainings to try to get the word out there that, the reality is that every person at some point in their life is going to experience something that is traumatic to them. And we're trying to train people, not just professionals, as far as people in my field, counselors and the like, but also teachers, Department of Children and Families workers, daycare workers, to be aware that behaviors that children or adults exhibit that seem out of line may be due to some trauma they experienced. And we're trying to train them on ways they can be more welcoming and maybe try to help the people calm down. And so it's more of an awareness.
Because people can be re-traumatized, I imagine,
unfortunately,
if it's handled the wrong way.
Yes, unfortunately, yes. If someone comes in and they're, let's say someone was traumatized as a child at their school. Well, then they have children. And so they go into the school to deal with some issue with their child. And they may immediately be on guard. They may immediately be irritable. And the teachers and other staff at the school don't understand why. They're going to think they just don't like them. And that's not the case. The case is this person is probably reliving a trauma or reliving some of the things that have happened to them in the past.
Right. And what are the main messages you try to convey to counselors in your field in approaching trauma?
To be aware, mostly. Be aware that, you can pretty much bet that 95% of the people who seek mental health services or behavioral health services have experienced some trauma. And to have a welcoming, warm atmosphere, not to assume that someone who comes in who's been abusing alcohol or drugs is just an addict, just someone who wanted to abuse alcohol or drugs, because that's not how it it happens.
Right. Most people don't decide, I want to be an addict when I grow up.
Right.
Well, Dr. Kimbrell, you and Melissa see the effects of trauma, you and your staff, every day. How do healthcare professionals protect themselves becoming post-traumatic stress victims?
That's a very good question. I mean, it can be very difficult. You know, we have different things that we do after, let's say if we have a bad case that comes in, and everyone who is involved with that try to have some kind of debriefing with social work and case management involved with that. And you know, it's just one of those things that we really have to keep an eye on. You know, as we progress as trauma surgeons, you see such a volume of it, unfortunately, and you're exposed to it to where, in a way, you start to kind of learn how to deal with it a little bit better. But it's still, you know, you never totally get used to that, and especially certain cases can be even more difficult.
Right.
So I think it's important to try to keep an eye on each other and see if you notice some symptoms, as you pointed out earlier, and to try to have those debriefing periods or opportunities.
So, Melissa, what would a coworker need to look for if a coworker were getting burnout?
A big one is definitely irritability. I know I keep saying that, but
so grouchy people,
in the
we need to love them instead of being irritated by them.
Yeah, we need to check it out with them and say, hey, what's going on? You know, you're acting a little different. I'd say any change in behavior, really. For some people, it may not be irritability if they're naturally irritable. It may be something else.
Right.
You know, kind of going through the day like, you know, a zombie. You just go from one thing to the next, and you know, you're not really seeing anything in your colleague, any emotion being expressed, because there's, you know, one response is being over emotional. The other response is lacking emotion completely, and just kind of going through the motions. So any of those things definitely need to look for, any change.
Well, studies unfortunately show that people who have the need for services of a trauma center typically do not follow up with behavioral health service. And this, as you mentioned, Dr. Kimbrell, can impede their recovery. What would the two of you recommend to help the survivors of trauma at Blake Medical Center?
I would like to see a specially trained behavioral health counselor available at the trauma center for immediate response to the survivors and their family members, to provide the support. You know, we already do that in our rape crisis department, and it has shown to work. It makes the process a little bit easier. You know, here's somebody that's dedicated solely to helping you feel a little more comfortable, helping you get through the moment.
Well, talk about rape crisis just a little bit, because that is a form of trauma that is supported in the emergency rooms. Manatee Glen's rape crisis responds to emergency rooms now for rape victims.
And we have for 20 plus years. And what happens is, if there's any sexual assault or rape that occurs in our county, law enforcement or the hospitals will are on call. We do have 24-hour on call, and an advocate will go out and be supportive to that person, to that survivor.
And if memory serves me, that was your first role at Manatee Glen's as a rape crisis
That was my
volunteer.
first job. Well, not really job. It was a free job. I was doing it for free. That was my first foray into this field.
So, and Manatee Glen's is still recruiting community volunteers to serve as rape crisis advocates. So that's an aspect where anyone can get involved with serving trauma victims in Manatee County. So, Dr. Kimbrell, what supports do the hospital offer in follow-up? Because you're going to be seeing the patient for a while,
right,
in their recovery.
Well, we have case management social work. It's actually a trauma social worker that's going to be rounding with us every day and trying to help assess that, as well as other issues with the patient and their family. But as well, you know, anytime that we feel that there is a need for a consultation from psychologists, psychiatrists, we will also have that opportunity to consult and have a consultation for that specific issue.
And I imagine there are ways to assess, as you see the patient recover, whether their psychological health is also bounding back.
Yes, and you know, usually again that would be probably more on the social workers or the other behavioral health workers to kind of assess.
Right.
It's a little bit out of my scope, but yes, there are different tools that can be used for that.
Well, we're almost out of time, but each of you have chosen really exciting and demanding professions, and our community is very grateful to you both. I wonder if there's any one case that comes to mind that makes you glad you chose this difficult profession.
I do have one. We had a young woman who had been severely abused, both physically or sexually, emotionally, in any way, every way imaginable. And last year, she's I think 17 now, and last year we had a trauma-informed care kickoff, kind of our kickoff to letting the community know, about trauma and that we all need to be sensitive to it. And she came and spoke about how much she had been helped, how supportive people were to her, and that she wouldn't have been able to do that without the help she received at Manatee Glen. So
Very young.
very young.
Very young. That speaks to the power of treatment. Dr. Kimbrell, do you have a case?
I guess one specific case would just be that, there have been multiple patients that I've seen who, you've turned their lives around, but there was one that was a 17-year-old young girl who was skiing. This was when I was in California. So she was skiing and they had an accident, flew her in, and she had multiple injuries and was in the ICU for over a month and things, and really severely injured, but recovered very well. And we also did have to have some behavioral health and psychological support for her in that. But her and her mother were so appreciative. This is actually rare in the trauma arena that they've actually stayed kind of connected to me, emailing me, sending me cards and things ever since. That's been about 8 years.
Kind of watching her grow up.
Yeah. Now, she's, finished college and things.
It's interesting that the both of you chose a young person, so I guess that's what reaches for your heart.
Yeah.
Well, we're out of time. This has been a very informative session, and that concludes this edition of the Manatee Glens Report. We've learned today that the mind-body connection between physical and psychological trauma has a profound effect on a person's recovery and quality of life. Physical and behavioral health care professionals like Dr. Kimbrell and Ms. Skinner are working together in our community to assure that both conditions are effectively treated. I'd like to thank our guests today for joining us on the show, and thank you for tuning in to the Manatee Glens Report on METV, where you can learn something new every day.